in the newborn nursery, before you had pizza and ribs and a cigarette or a blunt or whatever y'all do, Swisher Sweets, whatever y'all got going on, Black and Miles, I don't know what you're doing nowadays. Newborn nursery lasted 15 minutes. If you'll notice, you start developing plaque early on with the pizza and the wings, Papa John's, we call it, Papa John's blood vessel. Then you started a bad habit in college because you were stressed like you are now. So you either start smoking reefer or you start smoking cigarettes. And my God, is it important for you to know about both? Because you know, you got folk out there talking about reefer healthy for you. It's a leaf. It's natural. Shut up. Every time you smoke, you get vasoconstriction for 1 hour. Now, it ain't but 20 cigarettes in a pack, and it ain't but 24 hours in a day. If your crazy behind smoke a pack a day, you did this all day. So cigarettes affect afterload. You got older, but not wiser. So you still started eating garbage. So you kind of defended it because you called it Sunday dinner and you called it quick eating on the road while you was working. It's called fast food. So you done threw some fast food on top of this. You done got on deep in love with Sunday dinners, you know, 17-course meals and shit, okay? You still got that little habit that not too many of your friends know about because it's unpopular now at 40. And but you got the little habit on the side there, you do. And then you got this other thing you be doing, PlayStation. You got the fingers working, but your body ain't did shit. You have this thing where you drove to the curb to check the mail. You took the elevator to 2. You searched for a half hour in the Walmart parking lot for the best parking space. Y'all know who you are. I ain't gonna point you out now. That wouldn't be right. And so that's you. You are the quintessential of a couch potato when scandal is coming on. Okay, this is you, all right? So we got a little bit more problems. We got atherosclerotic plaque, which is from your diet, okay? It's causing that really big hole to go really narrow. Your smoking did a little bit more narrow. Cigarette, an hour, okay? So if you got up and said, I'm sick and tired of being sick and tired, I think I better get up and start working out. Working out vasodilates. No, you didn't get that memo. That Facebook post didn't reach you. So you just got bigger and bigger. And when you got bigger, it took more surface area to pump your blood through. That's called a BMI of 30, a body mass index of 30. So now you have a lot more tissue in your body surface area, to pump the blood through. Now, I just got to tell you that this blood vessel, if I think about the blood pressure, which means the force it takes to push blood through, that blood pressure, the force it takes to push the blood through, that went just like this in your 20s. But you have atherosclerosis now. You have these little plaques. You smoke now. I was just having a nice conversation with one of the babies that left out of my NCLEX review. She works in the SICU at MICU, gets all the, at Cleveland Clinic, gets all the heart people, all this shit. And she said, Shelly, I said, so do you see all the crap we talked about with the stupid blood vessels at your job? She goes, the number one crap that I have to say, and I wish I could have told your class when I was there, 99.99% of the people that she gets smoke. It's real, y'all. It's real. So the smoking, the atherosclerotic plaques, the obesity or more surface area, the lack of exercise, even the pooling of blood around your ankles, all this kind of stuff. If you think about what is the blood pressure for that patient, this is how that looks. That's called resistance. that's called afterload. The amount of resistance that I feel when I'm trying to pump the blood through your muscle is unreal. So it don't take much to get to a heart attack. It doesn't take a whole lot between these two. All it took was for the blood to clot. All it took was for one little piece of atherosclerotic plaque to break off. All it took was blood stasis to just sit and clot. That's what these people do. This is an MI. This is your heart attack. This is your coronary artery. But all of this stuff works on every artery. It ain't like it's just a coronary artery getting fucked up. No, your arteries all fucked up everywhere throughout your body. That's called peripheral vascular disease. Peripheral arterial disease. If it's real bad and you smoke 2 packs, here's what this artery does instead. You're pumping, then you smoke the cigarette. In fact, we know that these aneurysms happen right after the cigarette. And so the person with the aneurysm guaranteed smokes first. They definitely smoke. So this is what's happening every time you smoke. Ballooning, 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 years, ballooning. Am I getting bigger? Because the size of your aneurysm matters, doesn't it? When it gets so big, what does a balloon do? Boom! That's where you get the dissection or the aneurysm that ruptured. It just makes sense. And it happens immediately after cigarette or sex, which we'll talk about later. You see, y'all all awake now. You're looking good. Now you're like, really? Oh my God. Okay, now, so here we go. If you look at your handout, and we're a handout kind of people, so we got to go through our handout.